Question 1. Stakeholder feedback indicates that a patient's adult child is expressing significant anxiety and questioning several aspects of the current care plan, including the frequency of repositioning and the dietary modifications. The child believes these interventions are causing the patient discomfort and wishes to revert to previous practices. As a home health aide, how should you best address this situation? Option A. Provide the child with detailed medical records and research articles that support the current care plan, allowing them to independently review the evidence and come to their own conclusions about the effectiveness of the interventions. Option B. Schedule a brief meeting with the child to actively listen to their specific concerns, empathetically acknowledge their feelings, and then calmly explain the rationale behind the current care plan interventions, focusing on how they are designed to improve the patient's health and comfort, and offer to document their feedback for the supervising nurse. Option C. Agree with the child's assessment that the interventions are causing discomfort and suggest that you will advocate for a return to the previous care practices, as the family's input is crucial for patient satisfaction. Option D. Reassure the child that the care plan is being followed correctly and that their concerns are noted, but emphasize that the medical decisions are made by the physician and the nursing team, and that the aide's role is to implement the plan as directed. The correct answer is B. Schedule a brief meeting with the child to actively listen to their specific concerns, empathetically acknowledge their feelings, and then calmly explain the rationale behind the current care plan interventions, focusing on how they are designed to improve the patient's health and comfort, and offer to document their feedback for the supervising nurse. Explanation. This scenario presents a common professional challenge in home health aid services, navigating sensitive family dynamics while ensuring the patient's care plan is understood and followed. The challenge lies in balancing the family's emotional needs and concerns with the professional requirements of the care plan and the patient's privacy. Effective communication is paramount to building trust, fostering collaboration, and ultimately improving patient outcomes. The correct approach prioritizes clear, empathetic, and professional communication, focusing on shared goals for the patient's well-being. This aligns with ethical principles of patient advocacy and professional conduct, emphasizing respect for the patient's dignity and the family's role as stakeholders. It involves active listening, providing accurate information within professional boundaries, and seeking collaborative solutions. This approach upholds the home health aide's responsibility to provide quality care while respecting the family's involvement and concerns, ensuring all parties are informed and working together. An incorrect approach that dismisses or minimizes family concerns fails to acknowledge their emotional investment and potential valuable insights into the patient's condition and preferences. This can lead to mistrust, resistance, and a breakdown in the care team's effectiveness. Ethically, it demonstrates a lack of empathy and respect for the family's role. Another incorrect approach that overshares confidential patient information without explicit consent or a clear need-to-know basis violates patient privacy rights and professional boundaries. This can have legal and ethical repercussions and erode trust. An approach that avoids communication altogether leaves the family feeling uninformed and excluded, potentially leading to misunderstandings and unmet needs for both the patient and the family. This failure to engage can hinder the collaborative nature of home health care. Professionals should approach such situations by first actively listening to the family's concerns without interruption. They should then validate those concerns, acknowledging their feelings and the importance of their input. Next, they should clearly and concisely explain the care plan, focusing on the rationale behind specific interventions and how they benefit the patient. When addressing concerns, professionals should provide factual information within their scope of practice, offering reassurance and seeking collaborative problem-solving. If a concern falls outside the aide's scope, they should know when and how to escalate it to the appropriate supervisor or healthcare professional. Maintaining professional boundaries, respecting patient confidentiality, and fostering a partnership with the family are key to successful outcomes. Question 2. The control framework reveals that a home health aide is providing care to a patient and receives a verbal instruction from the patient's physician regarding a medication change. However, the aide's current care plan, developed by the supervising nurse, does not reflect this change. Which of the following actions best demonstrates adherence to professional practice and regulatory guidelines in this situation? Option A. Immediately implement the physician's verbal instruction, assuming it supersedes the existing care plan. Option B. Proceed with the care plan as written by the nurse and disregard the physician's verbal instruction, as it is not documented in the official plan. Option C. Attempt to interpret the physician's instruction based on general knowledge of the patient's condition and make a best guess about how to proceed. Option D. Contact the supervising nurse to clarify the physician's instruction and confirm the appropriate course of action before making any changes to the patient's care. The correct answer is A. Immediately implement the physician's verbal instruction, assuming it supersedes the existing care plan. Explanation. This scenario presents a common challenge in home health aid practice, managing conflicting information and ensuring patient safety when different healthcare professionals provide varying instructions. The professional challenge lies in prioritizing patient well-being and adhering to established protocols when faced with ambiguity or potential discrepancies in care plans. Careful judgment is required to discern the most appropriate course of action that aligns with the patient's overall health needs and regulatory mandates. The correct approach represents best professional practice because it emphasizes clear, documented communication and adherence to the established care plan. By seeking clarification from the supervising nurse, the home health aide ensures that they are acting on the most current and accurate information. This aligns with regulatory requirements for accurate record-keeping and communication within the healthcare team, promoting patient safety and continuity of care. It upholds the ethical principle of beneficence by prioritizing the patient's well-being and avoiding potentially harmful actions based on incomplete or conflicting information. An incorrect approach that involves proceeding with the physician's verbal instruction without confirming with the nurse fails to uphold the standard of care. This could lead to medication errors, adverse patient outcomes, and a breach of professional responsibility. It bypasses the established chain of command and communication protocols, potentially creating a situation where the patient receives contradictory treatments. This violates ethical obligations to act in the patient's best interest and regulatory requirements for accurate documentation and communication. Another incorrect approach, such as ignoring the physician's instruction and only following the nurse's initial plan, also presents a risk. While the nurse's plan is important, a physician's direct instruction, even if seemingly contradictory, requires investigation. Failing to address this discrepancy could mean missing a critical change in the patient's condition or a necessary adjustment to their treatment, potentially jeopardizing their health. This demonstrates a lack of proactive problem-solving and a failure to ensure comprehensive understanding of the patient's care. Finally, an incorrect approach of guessing or improvising a solution based on general knowledge is unacceptable. Home health aides are expected to follow specific care plans and protocols. Improvisation in healthcare can lead to serious errors and is a direct violation of professional standards and regulatory guidelines that mandate adherence to prescribed care. The professional decision-making process for similar situations should involve 1. Recognizing the discrepancy or ambiguity in instructions. 2. Prioritizing patient safety above all else. 3. Consulting the appropriate supervisor or healthcare professional, in this case, the supervising nurse, to clarify the instructions. 4. Documenting all communication and actions taken. 5. Adhering to the confirmed and updated care plan. Question 3. During the evaluation of a home health aide's performance, a scenario arises where a patient, who is experiencing incontinence, expresses significant embarrassment and reluctance to allow the aide to assist with toileting and changing incontinence briefs. The aide needs to decide on the best course of action to ensure the patient's hygiene and comfort while respecting their feelings and maintaining professional standards. Option A. Proceed with the toileting and brief change as quickly as possible to minimize the patient's discomfort and embarrassment without further discussion. Option B. Inform the patient that the care is mandatory and must be done immediately, regardless of their feelings, to prevent complications. Option C. Suggest to the patient that they try to manage their incontinence independently for now and attempt the care later when they are more willing, to avoid conflict. Option D. Gently explain the importance of hygiene for their health and comfort. Ask for their permission to proceed with the care, and offer choices regarding the process, such as allowing them to assist as much as they are able or choosing the time for the care if feasible. Correct answer is D. Gently explain the importance of hygiene for their health and comfort, ask for their permission to proceed with the care, and offer choices regarding the process, such as allowing them to assist as much as they are able or choosing the time for the care if feasible. Explanation. This scenario is professionally challenging because it requires a home health aide to balance the patient's immediate comfort and dignity with the need for effective hygiene and infection control, all within the scope of their professional responsibilities and regulatory guidelines. The patient's embarrassment and resistance to assistance complicate the situation, demanding sensitivity and skillful communication. The correct approach represents best professional practice because it prioritizes patient dignity and comfort while ensuring essential care is delivered safely and effectively. This involves clear, respectful communication, obtaining consent, and using appropriate techniques and supplies. Adhering to established protocols for toileting and incontinence care, as mandated by home health aid regulations, ensures patient safety, prevents skin breakdown, and minimizes the risk of infection. This approach aligns with ethical principles of autonomy, beneficence, and non-maleficence. An incorrect approach that involves forcing the patient to comply without addressing their concerns or obtaining consent violates the principle of patient autonomy and can lead to psychological distress and a breakdown of trust. This is a direct ethical failure and a potential regulatory violation related to patient rights and respectful care. Another incorrect approach that involves neglecting the care due to the patient's resistance or performing it in a rushed or undignified manner fails to meet the standard of care expected of a home health aide. This constitutes a failure in the duty of care, potentially leading to adverse health outcomes for the patient, e.g., skin breakdown, urinary tract infections, and is a breach of professional responsibility and regulatory requirements for providing consistent and adequate care. A third incorrect approach that involves using inappropriate or unsanitary supplies or techniques poses a significant risk of infection to both the patient and the aide, violating principles of safety and infection control, which are fundamental regulatory and ethical mandates. Professional decision-making in similar situations requires a systematic approach. First, assess the patient's immediate needs and emotional state. Second, communicate clearly and empathetically, explaining the necessity of the care and seeking cooperation. Third, obtain informed consent, respecting the patient's right to refuse or express concerns. Fourth, adapt the care plan based on the patient's response and preferences, while still ensuring essential care is provided. And fifth, document the interaction and any deviations from the plan, consulting with a supervisor if significant challenges arise. Question 4. Benchmark analysis indicates a common point of confusion in home care setting regarding the distinct roles and responsibilities of various direct care providers. Considering the regulatory framework governing home health services in the United States, which of the following best describes the primary difference in scope of practice between a home health aide, a personal care aide, and a nursing assistant? Option A. Nursing assistants are primarily responsible for all medical interventions, including medication administration and complex wound care, while home health aides and personal care aides are only permitted to provide companionship and light housekeeping. Option B. Home health aides and personal care aides have identical scopes of practice, both being able to perform all non-medical personal care tasks, while nursing assistants are limited to only assisting with activities of daily living. Option C. Home health aides are trained to perform a broader range of health-related tasks under nursing supervision, including some basic medical procedures, while personal care aides focus on non-medical personal care, and nursing assistants, with more extensive clinical training, often work in institutional settings, but can provide direct patient care in home settings under specific program guidelines. Option D. Personal care aides have the most comprehensive training and can perform all duties of a home health aide and a nursing assistant, as their role is to provide holistic care. The correct answer is C. Home health aides are trained to perform a broader range of health-related tasks under nursing supervision, including some basic medical procedures, while personal care aides focus on non-medical personal care, and nursing assistants, with more extensive clinical training, often work in institutional settings, but can provide direct patient care in home settings under specific program guidelines. Explanation: this scenario is professionally challenging because the lines between the roles of a home health aide, HHA, personal care aide, PCA, and nursing assistant, NA, can be blurred in practice, especially in a home setting where resources might be limited. Misunderstanding these distinctions can lead to providing care outside the scope of practice, potentially compromising patient safety and violating regulatory guidelines. Careful judgment is required to ensure that care aligns with the specific training, certification, and legal scope of practice for each role. The correct approach represents best professional practice because it accurately identifies the distinct responsibilities and limitations of each role as defined by relevant U.S. federal and state regulations, such as those under the Centers for Medicare and Medicaid Services, CMS, for Medicare-certified home health agencies. HHA, PCA, and NAs have different levels of training and are authorized to perform different tasks. HHA, for example, often have a broader scope that can include certain basic health-related tasks under the supervision of a nurse, while PCAs primarily focus on non-medical personal care. NA, typically working in institutional settings but sometimes in home care under specific programs, have a more extensive clinical training. Adhering to these distinctions ensures that care is delivered safely, effectively, and in compliance with all applicable laws and ethical standards, preventing both underservicing and overservicing of patient needs. An incorrect approach that fails to differentiate these roles would be professionally unacceptable due to specific regulatory and ethical failures. For instance, a home health aide performing tasks exclusively designated for a licensed nurse, such as administering medication, beyond what is permitted under specific state protocols for HHAs, or performing complex wound care, would violate the scope of practice defined by state nurse practice acts and federal Medicare/Medicaid regulations. This constitutes practicing beyond one's licensure or certification, which is a serious ethical and legal violation. Similarly, a personal care aide undertaking tasks that require the specific training of a home health aide, such as taking vital signs or assisting with certain therapeutic exercises, would also exceed their authorized scope, potentially leading to inaccurate assessments or harm to the patient. These failures undermine patient trust, compromise the quality of care, and expose the caregiver and agency to legal repercussions. The professional decision-making process for similar situations should involve a clear understanding of the patient's care plan, the specific training and certification of the caregiver, and the regulatory framework governing home health services in the relevant jurisdiction. When faced with a task, a professional should ask, is this task within the defined scope of my role as a home health aide, personal care aide, or nursing assistant according to federal and state regulations and my agency's policies? If there is any doubt, the professional should consult with their supervisor, a registered nurse, or the agency's compliance officer before proceeding. This proactive approach ensures that care remains within legal and ethical boundaries, prioritizing patient safety and well-being. Question 5. Operational review demonstrates that a home health aide has observed a client exhibiting new and concerning symptoms of dizziness and unsteadiness, which are not documented in the current care plan. The aide has basic first aid training, but is not a licensed medical professional. Which of the following actions best aligns with the home health aide's scope of practice and regulatory guidelines? Option A. Advise the client and their family to call emergency services immediately, as the symptoms sound serious. Option B. Reassure the client that these symptoms are likely due to fatigue and will pass, and continue with the scheduled care activities without reporting. Option C. Administer an over-the-counter motion sickness medication that the client has used previously for similar complaints, as this is a common remedy. Option D. Document the observed symptoms accurately in the client's record, and immediately report the change, in condition to the supervising nurse or agency administrator. The correct answer is D. Document the observed symptoms accurately in the client's record and immediately report the change, in condition to the supervising nurse or agency administrator. Explanation. Scenario analysis. This scenario presents a common challenge in home health aide practice, where a caregiver observes a change in a client's condition that falls outside their defined scope of practice. The professional challenge lies in balancing the caregiver's duty to provide care and support with the strict limitations of their role, ensuring client safety without overstepping boundaries or providing unauthorized medical interventions. Accurate assessment of the situation and appropriate reporting are paramount. Correct approach analysis. The correct approach involves recognizing the observed change as a potential symptom requiring professional medical evaluation, documenting the observation accurately, and immediately reporting it to the designated supervisor or healthcare professional. This aligns with the core principles of home health aide practice, emphasizing client safety, adherence to the care plan, and the critical importance of communication within the healthcare team. Regulations for home health aides universally mandate reporting changes in client condition to the appropriate personnel, as the aide is not authorized to diagnose or treat. This ensures continuity of care and timely intervention by licensed professionals. Incorrect approach is analysis. One incorrect approach involves attempting to manage the symptom independently by administering over-the-counter medication or suggesting home remedies. This is a direct violation of the home health aid scope of practice, which strictly prohibits independent medical interventions, diagnosis, or treatment. Such actions could lead to adverse client outcomes, mask underlying serious conditions, and expose the aid and agency to legal liability. Another incorrect approach is to dismiss the observed change as insignificant or a normal part of aging, without further investigation or reporting. This demonstrates a failure to recognize potential health deterioration and a disregard for the client's well-being. It neglects the ethical and regulatory obligation to report any changes that could impact the client's health status, potentially delaying necessary medical attention and compromising client safety. A third incorrect approach is to directly advise the client or their family to seek immediate emergency medical services without first consulting with the supervising nurse or agency. While the intention may be to ensure prompt care, bypassing the established reporting structure can lead to unnecessary emergency room visits, disrupt the established care plan, and fail to provide the supervising healthcare professional with the necessary information to make an informed decision about the appropriate level of care. The aide's role is to report and facilitate, not to independently direct emergency medical response. Professional reasoning. Professionals should employ a decision-making process that prioritizes client safety and adheres strictly to their defined scope of practice. This involves 1. Observation and assessment. Carefully observe and document any changes in the client's condition. 2. Scope of practice review. Determine if the observed change falls within the aide's authorized duties. 3. Reporting protocol. Immediately report the observation to the designated supervisor or healthcare professional as per agency policy and regulatory requirements. 4. Follow-up. Ensure the report has been received and understood, and follow any further instructions provided by the supervisor. This systematic approach ensures that client needs are met appropriately and within legal and ethical boundaries. Question 6. Regulatory review indicates that a home health aide is providing care to a patient who expresses a strong desire to perform an activity that is not included in their current care plan and that the aide believes may pose a safety risk. What is the most appropriate course of action for the home health aide? Option A. Attempt to perform the activity with the patient, assuming the aide has some familiarity with it, to avoid upsetting the patient. Option B. Firmly refuse the patient's request, stating that it is not within the aide's duties to deviate from the established care plan. Option C. Immediately fulfill the patient's request to respect their autonomy, as long as the patient verbally agrees to the activity. Option D. Politely explain to the patient that the activity is not part of their care plan, and consult with the supervising nurse to discuss the patient's request and assess any potential risks or benefits before proceeding. The correct answer is D. Politely explain to the patient that the activity is not part of their care plan and consult with the supervising nurse to discuss the patient's request and assess any potential risks or benefits before proceeding. Explanation. This scenario presents a professional challenge because it requires the home health aide to balance the patient's expressed preferences with their own professional judgment and the established care plan, all while adhering to regulatory guidelines. The aide must recognize that while patient autonomy is paramount, it is not absolute when it conflicts with safety or the established scope of practice. Careful judgment is required to assess the patient's capacity to make such decisions and to understand the potential implications of deviating from the care plan. The correct approach represents best professional practice because it prioritizes patient safety and adherence to the established care plan, which is developed based on medical necessity and professional assessment. By consulting with the supervising nurse, the aide ensures that any deviation is properly evaluated, documented, and approved, maintaining accountability and ensuring the patient receives appropriate care. This aligns with regulations that mandate aides to work under the supervision of a licensed healthcare professional and to report any changes in patient condition or concerns about the care plan. An incorrect approach that involves directly fulfilling the patient's request without further consultation fails to uphold the aide's responsibility to the patient's well-being and the integrity of the care plan. This could lead to adverse health outcomes, potentially violating regulations concerning patient safety and the scope of practice for home health aides. Another incorrect approach, that of dismissing the patient's request outright without understanding the underlying reasons or exploring alternatives, demonstrates a lack of patient-centered care and may erode trust, potentially impacting the therapeutic relationship and the patient's willingness to adhere to other aspects of their care. This can also be seen as a failure to adequately assess the patient's needs and preferences, which is a core ethical and regulatory expectation. Professionals should employ a decision-making framework that begins with active listening and assessment of the patient's request and its underlying reasons. This should be followed by an evaluation of the request against the established care plan and safety protocols. If there is a discrepancy or concern, the next step is to consult with the supervising nurse or other appropriate healthcare professional to discuss the situation, gather further guidance, and determine the best course of action, ensuring all decisions are documented and communicated. Question 7. The evaluation methodology shows that a home health aide is providing care to an elderly patient who has expressed a desire to remain independent in their home. The patient's adult children, who live out of state, have contacted the aide expressing significant concerns about their parents' safety and have requested that the aide implement additional, more restrictive care measures that the patient has not requested and appears resistant to. The aide is unsure how to balance the family's urgent requests with the patient's expressed wishes and the established care plan. Which of the following approaches best addresses this professionally challenging situation? Option A. The aide should facilitate a discussion between the patient and their children, with the aide present, to openly address the concerns and collaboratively explore potential solutions that respect the patient's autonomy and align with the care plan, involving the supervising nurse as needed. Option B. The aide should immediately implement the additional restrictive care measures requested by the children, as their concerns about safety are paramount, and the aide's primary duty is to prevent harm. Option C. The aide should agree to the children's requests to ensure family satisfaction and avoid conflict, documenting the changes as if they were initiated by the patient's needs. Option D. The aide should inform the children that their requests cannot be implemented because the patient has not agreed to them, and then continue to provide care strictly according to the existing care plan without further discussion. The correct answer is A. The aide should facilitate a discussion between the patient and their children, with the aide present, to openly address the concerns and collaboratively explore potential solutions that respect the patient's autonomy and align with the care plan, involving the supervising nurse as needed. Explanation. This scenario is professionally challenging because it requires the home health aide to navigate a sensitive family dynamic while prioritizing the patient's well-being and adhering to professional communication standards. The aide must balance the family's expressed concerns with the patient's stated preferences and the professional assessment of care needs, all within the regulatory framework governing home health services. Careful judgment is required to ensure patient autonomy is respected and that communication remains professional and objective. The correct approach represents best professional practice because it emphasizes open, respectful communication with all parties involved, including the patient and their family, while maintaining professional boundaries and focusing on the patient's care plan. This aligns with ethical principles of patient-centered care, autonomy, and beneficence, as well as regulatory requirements for clear and consistent communication between caregivers, patients, and their families. It ensures that decisions are made collaboratively and in the best interest of the patient, documented appropriately, and that the patient's wishes are central to the care provided. An incorrect approach that involves dismissing the family's concerns outright would be a regulatory and ethical failure. It disregards the family's role in the patient's support system and could lead to a breakdown in trust and cooperation, potentially impacting the patient's overall care and well-being. Ethically, it fails to acknowledge the family's legitimate interest in the patient's welfare. Another incorrect approach, such as agreeing to all of the family's demands without considering the patient's input or the professional care plan, would also be a significant failure. This undermines patient autonomy and could lead to inappropriate care or interventions that are not medically necessary or desired by the patient. It also bypasses the established care plan and professional judgment, potentially violating regulatory guidelines for care provision. A further incorrect approach, such as avoiding communication with the family altogether and only interacting with the patient, would be a failure in professional responsibility. While patient confidentiality is paramount, families often play a crucial role in a patient's support network and can provide valuable insights. Complete avoidance can lead to misunderstandings, lack of coordination, and a feeling of exclusion for the family, which can negatively impact the patient's care environment. The professional decision-making process for similar situations should involve active listening to all parties, clearly identifying the patient's stated needs and preferences, assessing the validity and impact of family concerns, consulting with the supervising nurse or care manager, and documenting all communication and decisions thoroughly. The focus should always remain on the patient's best interests, respecting their autonomy and dignity, while fostering a collaborative and transparent care environment. Question 8. Strategic planning requires a home health aide to consider the most appropriate course of action when a patient expresses confusion about a prescribed medication they are scheduled to take. Which of the following actions best upholds patient safety and regulatory compliance? Option A. Encourage the patient to take the medication immediately to prevent delays in their treatment schedule. Option B. Document the patient's confusion but proceed with administering the medication as ordered without further inquiry. Option C. Administer the medication as prescribed, assuming the patient's confusion is temporary and will resolve. Option D. Gently explain the purpose of the medication to the patient and administer it if they still agree to take it. Otherwise, report the confusion to the supervising nurse. Correct answer is C. Administer the medication as prescribed, assuming the patient's confusion is temporary and will resolve. Explanation. This scenario is professionally challenging because it requires balancing the patient's autonomy and preferences with the home health aide's responsibility to ensure safe and effective medication management, adhering strictly to the established care plan and regulatory guidelines. The aide must navigate potential communication barriers, the patient's cognitive state, and the critical need for accurate medication administration. The correct approach represents best professional practice because it prioritizes patient safety and adherence to the physician's orders and the agency's policies, which are grounded in regulatory frameworks governing home health care. This approach involves clear communication with the patient about the medication, verifying the medication against the care plan, and administering it as prescribed. If there are any discrepancies or concerns, the aide correctly escalates the issue to the supervising nurse, ensuring that any deviations are addressed by a qualified healthcare professional. This aligns with regulations that mandate accurate medication administration and reporting of any adverse events or concerns. An incorrect approach that involves administering medication without verifying it against the care plan or the physician's orders is a direct violation of medication safety protocols and regulatory requirements. This could lead to medication errors, such as administering the wrong drug, wrong dose, or to the wrong patient, posing significant health risks and potentially violating patient rights. Another incorrect approach, such as ignoring a patient's refusal or confusion about medication, disregards patient autonomy and the requirement for informed consent, even if the patient's understanding is impaired. This could lead to forced medication, which is ethically and legally unacceptable. Failing to report a medication error or a patient's adverse reaction to the supervising nurse is a critical regulatory failure, as it prevents timely intervention and can have severe consequences for the patient's health and well-being, and it obstructs the agency's ability to monitor and improve care quality. Professionals should use a decision-making framework that begins with understanding the patient's care plan and physician's orders thoroughly. They should then assess the patient's current state and ability to participate in their care. When administering medication, a systematic verification process, e.g., the 5 rights of medication administration, right patient, right drug, right dose, right route, right time is crucial. Any deviation, patient concern, or observed adverse effect should trigger a pause and escalation to the supervising nurse. Documentation of all actions and observations is also a critical component of professional practice and regulatory compliance. Question 9. Implementation of a safe and dignified dressing routine for a home health aide client who has limited mobility in their arms and expresses frustration when assistance is offered requires the aide to: Option A. Perform the entire dressing process quickly to minimize client discomfort without detailed explanation or seeking their input. Option B. Force the client's limbs into the clothing to expedite the process, disregarding their verbal resistance. Option C. Explain each step of the dressing process, offer choices for garments, and allow the client to participate in the dressing as much as they are able, providing assistance only where needed. Option D. Cease the dressing attempt entirely when the client shows signs of frustration and resistance, leaving them undressed. Correct answer is C. Explain each step of the dressing process, offer choices for garments, and allow the client to participate in the dressing as much as they are able, providing assistance only where needed. Explanation. Scenario analysis. This scenario presents a common challenge in home health aid care, balancing a client's desire for independence with the need for safe and effective assistance. The client's frustration and resistance to help, coupled with the physical limitations of dressing, require the aide to employ patience, empathy, and a thorough understanding of safe techniques. The aide must also respect the client's dignity and autonomy while ensuring their well-being. Correct approach analysis. The correct approach prioritizes the client's dignity, safety, and independence. By explaining the process, offering choices, and allowing the client to participate as much as possible, the aide fosters a sense of control and respect. This aligns with ethical principles of patient-centered care and the regulatory expectation that home health aides promote client independence and well-being within their capabilities. Specifically, this approach adheres to guidelines that mandate respectful care, client involvement in decision-making regarding their care, and the use of appropriate techniques to prevent injury. Incorrect approach is analysis. One incorrect approach involves performing the entire dressing process without client input or explanation. This disregards the client's autonomy and can lead to feelings of disempowerment and frustration, potentially violating ethical standards of respecting client wishes and dignity. It also fails to assess the client's actual capabilities, which is a regulatory requirement for providing appropriate care. Another incorrect approach is to force the client into the clothing or to rush the process. This is not only undignified and disrespectful, but also poses a significant safety risk, potentially causing injury to the client. Regulatory frameworks strictly prohibit any form of abuse or neglect, and this approach would fall under that category by failing to provide care in a safe and considerate manner. A third incorrect approach is to abandon the task due to the client's resistance without exploring alternative strategies or seeking further guidance. This demonstrates a failure to provide consistent and necessary care, which is a core responsibility of a home health aide. It could also be seen as neglect, as the aide is not fulfilling their duty to assist the client with essential daily living activities. Professional reasoning. Home health aides should approach dressing and undressing by first assessing the client's current abilities and any limitations. They should then communicate clearly with the client, explaining what they are going to do and why. Offering choices, such as which garment to wear or how much assistance is needed, empowers the client. The aide should then proceed with the dressing process, allowing the client to do as much as they can independently, while providing assistance only where necessary and in a way that maintains the client's dignity and safety. If resistance is encountered, the aide should pause, reevaluate, and attempt to understand the client's concerns, perhaps by offering a break or trying a different approach. If the situation remains challenging, seeking guidance from a supervisor or nurse is the appropriate next step. Question 10. Market research demonstrates that effective monitoring and documentation are critical for ensuring quality home health care. A home health aide is caring for an elderly client who has recently experienced a fall. The aide observes that the client is now more hesitant to ambulate, reports increased pain in their hip when moving, and has a visible bruise on their left thigh. The aide also notes that the client expresses feeling a bit down, but states they are managing. Which of the following approaches to documenting this client's progress best aligns with regulatory requirements and professional best practices for a home health aide? Option A. Document that the client is experiencing increased pain and has a visible bruise, but omit the observation about their increased hesitancy to ambulate and their stated feeling of being a bit down to avoid alarming the client or the agency. Option B. Document that the client is experiencing increased pain and has a visible bruise, noting their increased hesitancy to ambulate and their stated feeling of being a bit down, and report these observations to the supervising nurse. Option C. Document that the client is feeling a bit down but is managing, and that their hip pain is not significantly impacting their mobility. Option D. Document only the client's statement that they are managing and feeling a bit down, without mentioning the observed pain, bruise, or hesitancy to ambulate. The correct answer is B. Document that the client is experiencing increased pain and has a visible bruise, noting their increased hesitancy to ambulate and their stated feeling of being a bit down, and report these observations to the supervising nurse. Explanation. This scenario is professionally challenging because accurately monitoring and documenting a client's progress in a home health setting requires keen observation, objective reporting, and adherence to specific regulatory standards. The home health aide must balance the need for detailed information with the client's privacy and comfort, ensuring that documentation is both comprehensive and respectful. Careful judgment is required to distinguish between subjective feelings and objective changes in the client's condition, and to recognize when to escalate concerns to the supervising nurse. The correct approach represents best professional practice because it prioritizes accurate, objective, and timely recording of client status and any changes observed. This aligns with the fundamental regulatory requirement for home health agencies to maintain thorough and accurate client records, which are essential for continuity of care, billing, and demonstrating compliance with federal and state regulations. E.g. Medicare conditions of participation for home health agencies in the U.S. Objective documentation allows the healthcare team to assess the effectiveness of the care plan, identify trends, and make informed decisions about the client's ongoing needs. Ethical practice dictates that all client information be recorded truthfully and without bias. An incorrect approach that focuses solely on the client's stated feelings without observing objective changes fails to meet regulatory requirements for comprehensive documentation. It risks overlooking subtle but significant physical or functional declines that the client may not articulate or may attribute to normal aging. This can lead to delayed interventions and potentially adverse health outcomes, violating the ethical duty of care. Another incorrect approach that involves summarizing progress without specific details or quantifiable observations is insufficient for regulatory compliance and clinical decision-making. Regulations require documentation that is specific enough to understand the client's condition and the care provided. Vague summaries do not provide the necessary information for the supervising nurse or other healthcare professionals to evaluate the care plan or the client's response to it. This can also lead to billing inaccuracies and potential fraud investigations. An incorrect approach that omits any mention of a decline in a client's condition, even if observed, is a serious ethical and regulatory failure. This constitutes falsification of records, which can have severe legal and professional consequences, including loss of licensure and civil penalties. It directly violates the principle of honesty in documentation and the duty to report changes in a client's status accurately. The professional decision-making process for similar situations should involve a systematic approach. 1. Observe. Actively and objectively observe the client's physical, mental, and emotional state, as well as their functional abilities and environment. 2. Record. Document all observations factually using clear, concise language. Include specific details, dates, and times. Quantify where possible, e.g., ambulated 50 feet with walker rather than walked a bit. 3. Report. Communicate any significant changes or concerns to the supervising nurse promptly, following agency protocols. 4. Review. Understand the established care plan and document progress, or lack thereof, in relation to the goals outlined in that plan. 5. Reflect. Consider the implications of observations and documentation for the client's overall well-being and the effectiveness of the care being provided. Question 11. System analysis indicates that a home health aide is assisting an elderly client with dementia who is resisting being dressed for the day. The client states, "I don't want to get dressed, leave me alone." The aide observes that the client is not dressed and appears uncomfortable, and that delaying dressing could impact their ability to participate in scheduled activities. Option A. Leave the client in their nightclothes, respecting their stated preference to be left alone, and document the refusal. Option B. Firmly insist that the client must get dressed now, as it is a non-negotiable part of their daily routine. Option C. Immediately proceed to dress the client, explaining that it is part of the care plan and must be done. Option D. Gently explain to the client why getting dressed is important for their comfort and participation in activities, and offer to help them choose their clothes and get dressed, respecting their pace. The correct answer is D. Gently explain to the client why getting dressed is important for their comfort and participation in activities, and offer to help them choose their clothes and get dressed, respecting their pace. Explanation. This scenario presents a common challenge in home health aide practice, balancing a client's expressed preferences with their safety and well-being, particularly when cognitive impairment is a factor. Professional challenge lies in respecting the client's autonomy while fulfilling the duty of care mandated by regulations and ethical guidelines. The aide must assess the situation, consider the client's current capacity, and make a judgment call that prioritizes safety without unnecessarily infringing on the client's dignity or independence. The correct approach represents best professional practice because it involves a direct, respectful, and safety-conscious intervention. By gently explaining the need for assistance and offering support, the aide upholds the client's dignity while ensuring a critical ADL is performed safely. This aligns with regulatory frameworks that emphasize person-centered care, promoting independence where possible, and ensuring client safety. Ethically, it demonstrates compassion and respect for the individual. An incorrect approach that involves forcing the client to comply or performing the task without explanation would be a significant ethical and regulatory failure. Forcing compliance disregards the client's autonomy and can lead to distress, resistance, and a breakdown of trust, violating principles of respectful care. Performing the task without explanation, even if seemingly efficient, can be perceived as demeaning and infantilizing, undermining the client's sense of self-worth and control, which is contrary to person-centered care principles. Another incorrect approach, such as ignoring the client's resistance and leaving them to manage independently, would be a failure to provide necessary care and ensure safety, directly contravening the aide's professional responsibilities and potentially leading to harm. Professional decision-making in such situations requires a systematic approach. First, assess the client's immediate safety and needs. Second, consider the client's expressed wishes and cognitive capacity. Third, communicate clearly and respectfully, offering choices and support. Fourth, if resistance persists and safety is compromised, seek guidance from a supervisor or nurse. And fifth, document the interaction and the decision made. Question 12. Compliance review shows a home health aide assisting a client with a meal. The aide is seated at the table with the client, offering food from a plate. The client appears to be swallowing without obvious difficulty, but the aide is feeding the client at a rapid pace, finishing the meal in less than 10 minutes. The client has a history of mild dysphagia. Which of the following approaches best demonstrates adherence to best practices for assisting with feeding? Option A. Offering food in small, manageable portions and allowing the client to set the pace of the meal while observing for any signs of swallowing difficulty. Option B. Assuming the client can manage independently and only intervening if they explicitly ask for help. Option C. Prioritizing the aide's preferred food choices for the client to ensure they consume a balanced meal. Option D. Feeding the client as quickly as possible to ensure the meal is completed within a short time frame. The correct answer is A. Offering food in small, manageable portions and allowing the client to set the pace of the meal while observing for any signs of swallowing difficulty. Explanation. Scenario analysis. Assisting a client with feeding presents a professionally challenging situation due to the inherent vulnerability of the client and the intimate nature of the task. The home health aide must balance the client's nutritional needs and preferences with their physical limitations and potential safety risks, such as choking or aspiration. Maintaining the client's dignity and autonomy throughout the process is paramount, requiring sensitivity and respect. The aide must also be observant for any changes in the client's condition or appetite that might indicate underlying health issues. Correct approach analysis. The correct approach involves a comprehensive assessment of the client's needs and preferences before initiating feeding. This includes understanding their dietary restrictions, allergies, preferred foods, and any specific feeding techniques recommended by a healthcare professional. E.g., positioning, thickened liquids. The aide should ensure the client is in an upright position to minimize the risk of aspiration, offer food in small, manageable portions, and allow the client to dictate the pace of feeding as much as possible. Regular verbal cues and observation for signs of distress or difficulty swallowing are crucial. This approach aligns with best practices for client safety, dignity, and person-centered care, as mandated by general home health aide ethical guidelines and regulatory frameworks that emphasize client well-being and individualized care plans. Incorrect approaches analysis. One incorrect approach involves rushing the feeding process to complete the task quickly. This disregards the client's pace and potential difficulties, increasing the risk of choking and aspiration, and undermining the client's autonomy and dignity. It fails to adhere to the principle of providing safe and person-centered care. Another incorrect approach is to assume the client can manage independently without offering assistance or checking for their comfort and ability to swallow. This can lead to inadequate nutrition and hydration, and potentially unsafe eating practices, violating the aide's duty of care. Finally, ignoring the client's stated food preferences or dietary restrictions in favor of convenience or personal judgment is a significant ethical and regulatory failure. It disrespects the client's autonomy and can have serious health consequences, such as allergic reactions or exacerbation of medical conditions. Professional reasoning. Home health aides should approach feeding assistants by first reviewing the client's care plan for specific instructions and dietary needs. They should then engage the client in a conversation about their preferences and current appetite. Before starting, the aide must ensure the environment is conducive to safe eating, e.g., proper lighting, minimal distractions, and that the client is positioned correctly. During feeding, consistent observation for swallowing ability and signs of fatigue or distress is essential. The aide should communicate with the client throughout the process, offering choices and respecting their cues to stop or slow down. Any concerns or changes in the client's condition should be documented and reported to the supervisor or healthcare team promptly. This systematic, client-focused approach ensures safety, promotes dignity, and upholds professional standards. Question 13. Investigation of a home health aide's response when a patient with a medically prescribed low-sodium diet requests to have their favorite salty snack, which is not on their approved food list. Option A. The aide provides the patient with the salty snack, assuming the patient knows best about their own dietary needs. Option B. The aide immediately consults the supervising nurse to discuss the patient's request and explore potential approved alternatives or confirm the strictness of the restriction. Option C. The aide tells the patient they cannot have the snack and offers no further explanation or alternative. Option D. The aide decides the low-sodium diet is probably not that important anymore and allows the patient to have the snack. The correct answer is B. The aide immediately consults the supervising nurse to discuss the patient's request and explore potential approved alternatives or confirm the strictness of the restriction. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the home health aide to balance the patient's expressed preferences with critical medical dietary restrictions. Failure to adhere to these restrictions can have severe health consequences, while ignoring the patient's comfort and autonomy can lead to distress and noncompliance. The aide must navigate this delicate balance while operating within the scope of their professional responsibilities and the patient's care plan. Correct approach analysis. The correct approach prioritizes patient safety and adherence to the prescribed medical diet. This aligns with the fundamental ethical and regulatory duty of a home health aide to provide care that supports the patient's health and well-being, as outlined in the patient's care plan and relevant healthcare regulations. By consulting with the supervising nurse, the aide ensures that any deviation from the diet is medically appropriate and authorized, thereby upholding professional standards and patient safety. This demonstrates a commitment to following established protocols and seeking guidance when faced with complex situations. Incorrect approaches analysis. One incorrect approach involves directly accommodating the patient's request without verification. This fails to uphold the home health aide's responsibility to follow the prescribed dietary plan, which is established for medical reasons. It bypasses the crucial step of ensuring patient safety and could lead to adverse health outcomes, violating ethical obligations and potentially regulatory guidelines regarding patient care standards. Another incorrect approach is to dismiss the patient's request outright without further investigation or communication. Adherence to the diet is paramount. A compassionate and patient-centered approach also involves understanding the patient's desires and addressing their concerns. Ignoring the patient's expressed preference without attempting to find a suitable alternative or explain the reasoning behind the restriction can lead to patient dissatisfaction and a breakdown in the therapeutic relationship, which is ethically problematic. A third incorrect approach is to assume the dietary restriction is no longer necessary without any professional consultation. This demonstrates a lack of understanding of the importance of medical directives and the potential consequences of altering a prescribed diet. It represents a failure to follow established care protocols and a disregard for the patient's medical condition, which could have serious health implications and is a clear breach of professional duty. Professional reasoning. Home health aides should employ a decision-making framework that begins with understanding the patient's care plan, including all dietary restrictions. When a patient expresses a desire that conflicts with these restrictions, the aide's immediate step should be to consult with the supervising nurse or other designated healthcare professional. This ensures that any decision made is informed, safe, and aligned with the patient's medical needs and the care plan. The aide should also practice empathetic communication, explaining the rationale behind the restrictions to the patient in an understandable manner, while also exploring if any safe and approved alternatives can be offered. Question 14. What factors determine the most appropriate method for assisting a client with personal care skills, such as bathing or dressing in a home health setting? Option A. The home health aide's personal experience and efficiency in performing the tasks. Option B. A standardized care protocol that outlines the quickest way to complete personal care. Option C. The availability of specific adaptive equipment, regardless of the client's comfort or preference. Option D. The client's expressed preferences, level of independence, and specific care needs, alongside clear communication and consent. The correct answer is D. The client's expressed preferences, level of independence, and specific care needs, alongside clear communication and consent. Explanation. The scenario of assisting a client with personal care skills presents a professional challenge due to the inherent vulnerability of the client and the intimate nature of the tasks involved. Home health aides must navigate a delicate balance between providing necessary assistance and respecting the client's dignity, autonomy, and privacy. This requires careful judgment, sensitivity, and a thorough understanding of the client's individual needs and preferences, as well as adherence to professional standards and regulatory requirements. The correct approach, which prioritizes the client's expressed preferences and involves clear communication and collaboration, represents best professional practice. This aligns with regulatory frameworks and ethical guidelines that emphasize client-centered care, informed consent, and the promotion of independence and self-determination. By actively involving the client in decision-making regarding their personal care, the home health aide upholds the client's right to autonomy and ensures that care is delivered in a manner that is most comfortable and respectful for them. This approach fosters trust and a positive therapeutic relationship, which are crucial for effective care delivery. Incorrect approaches fail to uphold these fundamental principles. An approach that solely relies on the aide's assumptions or a standardized routine, without considering the client's input, disregards the client's autonomy and can lead to feelings of disempowerment or distress. This violates ethical principles of respect for persons and can contravene regulations that mandate person-centered care planning. Another incorrect approach, which might involve performing tasks without adequate explanation or seeking consent, breaches the client's right to privacy and can be perceived as intrusive or disrespectful. This can lead to a breakdown in trust and potentially violate regulations concerning client rights and dignity. A third incorrect approach, which might involve rushing through tasks to save time, compromises the quality of care and can lead to errors or omissions, potentially endangering the client's well-being and violating standards of care. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly assessing the client's individual needs, preferences, and any limitations. Second, engaging in open and honest communication with the client, explaining proposed care actions, and seeking their consent and input. Third, adapting care plans based on the client's feedback and evolving needs. Fourth, documenting all care provided and any changes or concerns. Finally, consulting with supervisors or other healthcare professionals when faced with complex situations or uncertainties. This iterative process ensures that care remains client-centered, safe, and respectful. Question 15. When evaluating a home health aide's role in nutrition and meal preparation for a client with diabetes and a preference for traditional cultural dishes, which approach best ensures the client's health, safety, and autonomy while adhering to professional guidelines? Option A. Preparing meals based solely on the client's expressed desire for traditional cultural dishes, assuming they are aware of their diabetic condition and can manage their own dietary intake. Option B. Preparing meals that strictly adhere to a standard diabetic diet, regardless of the client's cultural preferences, to ensure maximum health benefit. Option C. Collaborating with the client's registered nurse or a registered dietitian to develop a meal plan that accommodates both the client's dietary restrictions for diabetes and their cultural food preferences, and then preparing meals according to this plan. Option D. Allowing the client to choose any foods they desire, as long as they are prepared hygienically, without considering their diabetic condition or professional dietary recommendations. The correct answer is C. collaborating with the client's registered nurse or a registered dietitian to develop a meal plan that accommodates both the client's dietary restrictions for diabetes and their cultural food preferences, and then preparing meals according to this plan. Explanation: this scenario is professionally challenging because it requires the home health aide, HHA, to balance the patient's preferences with their nutritional needs and safety, all within the scope of their professional responsibilities and regulatory guidelines. The HHA must act as a caregiver and advocate, ensuring the patient receives appropriate nutrition while respecting their autonomy and cultural background. Careful judgment is required to identify potential risks and implement safe, effective meal preparation strategies. The correct approach represents best professional practice because it prioritizes the patient's well-being and safety by consulting with the appropriate healthcare professionals. This aligns with the regulatory framework for HHAs, which mandates that they operate within their scope of practice and report any concerns or changes in a patient's condition to their supervisor or a registered nurse. Seeking guidance from a registered dietitian or nurse ensures that the meal plan is nutritionally sound, safe for the patient's specific health conditions, e.g., diabetes, allergies, swallowing difficulties, and respects the patient's preferences. This collaborative approach upholds ethical principles of beneficence and non-maleficence. An incorrect approach that involves preparing meals solely based on the patient's expressed desires without considering their medical needs or consulting with healthcare professionals is a significant regulatory and ethical failure. This could lead to adverse health outcomes, such as exacerbating existing conditions or causing allergic reactions, violating the HHA's duty of care. Another incorrect approach, such as ignoring the patient's preferences entirely and imposing a rigid diet, disrespects the patient's autonomy and can negatively impact their quality of life and adherence to the meal plan. This fails to meet the ethical standard of respecting patient dignity. A third incorrect approach, such as documenting the patient's refusal of recommended foods without further investigation or reporting, neglects the HHA's responsibility to monitor and report changes in the patient's nutritional intake and potential health risks. The professional decision-making process for similar situations should involve a systematic approach. 1. Assess the patient's current nutritional status and any known dietary restrictions or recommendations from their healthcare provider. 2. Actively listen to and acknowledge the patient's food preferences and cultural background. 3. Identify any potential conflicts between preferences and medical needs. 4. Consult with the supervising nurse or a registered dietitian to develop a safe and appropriate meal plan that incorporates patient preferences where possible. 5. Educate the patient about their dietary needs and the rationale behind recommendations. 6. Document all assessments, interventions, and communications accurately. 7. Continuously monitor the patient's intake and response to the meal plan, reporting any concerns promptly. Question 16. The audit findings indicate that during initial client assessments, some home health aides are prioritizing the immediate completion of requested tasks over a comprehensive evaluation of the client's overall health and home environment. Which of the following approaches best aligns with regulatory requirements and best professional practice for conducting an initial client assessment? Option A. Completing a brief checklist of observable tasks and vital signs, assuming that more detailed information can be gathered during subsequent visits. Option B. Relying heavily on information provided by the client's family and previous agency documentation, with minimal direct questioning of the client themselves. Option C. Focusing primarily on the specific care tasks the client or their family explicitly requests during the initial visit, ensuring these are completed efficiently. Option D. Systematically gathering information on the client's medical history, current medications, functional status, cognitive abilities, psychosocial situation, and home environment, while also observing for any immediate safety concerns. The correct answer is D. Systematically gathering information on the client's medical history, current medications, functional status, cognitive abilities, psychosocial situation, and home environment, while also observing for any immediate safety concerns. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the home health aide to balance the immediate need for care with the regulatory and ethical imperative of a thorough initial assessment. The audit findings highlight a potential gap in practice, suggesting that the aide might be prioritizing task completion over comprehensive client evaluation. This can lead to misdiagnoses, inadequate care planning, and ultimately, compromised client safety and well-being. Careful judgment is required to ensure all necessary components of an initial assessment are addressed, even when faced with time pressures or perceived urgency. Correct approach analysis. The correct approach involves systematically gathering information across multiple domains during the initial client visit. This includes a detailed review of the client's medical history, current medications, functional status, mobility, activities of daily living, cognitive abilities, psychosocial situation, and home environment. This comprehensive approach aligns with the fundamental principles of client-centered care and regulatory requirements for home health agencies, which mandate a thorough assessment to develop an individualized care plan. By conducting a complete assessment, the aide ensures that all potential needs and risks are identified, leading to more effective and safer care delivery. This proactive approach prevents potential complications and ensures compliance with standards of practice. Incorrect approaches analysis. One incorrect approach involves focusing solely on the immediate care tasks requested by the client or family without conducting a broader assessment. This fails to identify underlying issues or potential risks that may not be immediately apparent but are crucial for safe and effective care. It violates the ethical principle of beneficence by not acting in the client's best interest and can lead to regulatory noncompliance by not fulfilling the requirement for a comprehensive initial assessment. Another incorrect approach is to rely solely on information provided by family members or previous agency notes without direct client interaction and verification. Family input is valuable. The client is the primary source of information regarding their own health status and needs. Over-reliance on secondary sources can lead to incomplete or inaccurate assessments, potentially missing critical client-specific details. This approach also risks violating client autonomy and privacy if their direct input is not sought. A third incorrect approach is to rush through the assessment process, completing only the most obvious or easily observable aspects of care. This demonstrates a lack of diligence and a failure to adhere to professional standards. It can result in overlooking subtle but significant changes in the client's condition, medication side effects, or environmental hazards, thereby compromising client safety and potentially leading to adverse events. This approach directly contravenes the spirit and letter of regulations, requiring a thorough and systematic initial evaluation. Professional reasoning. Professionals should approach initial client assessments with a structured yet flexible mindset. This involves utilizing a standardized assessment tool or checklist to ensure all critical areas are covered, while also remaining attentive to the client's verbal and nonverbal cues. Active listening, open-ended questioning, and observation are key skills. Professionals should prioritize understanding the client's overall situation, not just the immediate task at hand. If time constraints are a concern, it is essential to communicate this to the supervisor and advocate for sufficient time to complete the assessment properly, rather than compromising its quality. Documentation should accurately reflect the findings of the comprehensive assessment. Question 17. Cost-benefit analysis shows that proactive monitoring of subtle physiological changes can prevent more serious health complications, but also carries the risk of overintervention. A home health aide is caring for a client whose usual resting respiratory rate is 14 breaths per minute. Today, the aide observes the client's respiratory rate to be 18 breaths per minute, while the client is resting comfortably and watching television, with no reported shortness of breath or other distress. What is the most appropriate course of action for the home health aide? Option A. Document the respiratory rate of 18 breaths per minute and continue to monitor the client as per the established care plan, noting the absence of other symptoms. Option B. Immediately contact the client's physician to report the increase in respiratory rate, as any deviation from the baseline requires immediate medical attention. Option C. Assume the slight increase is insignificant and does not require any specific action or documentation, as the client is not exhibiting any distress. Option D. Advise the client to take slow, deep breaths to try and lower their respiratory rate back to their baseline before documenting. The correct answer is A. Document the respiratory rate of 18 breaths per minute and continue to monitor the client as per the established care plan, noting the absence of other symptoms. Explanation. This scenario presents a professional challenge because a home health aide must interpret a subtle but potentially significant change in a client's vital signs within the context of their overall condition and the established care plan. The aide's responsibility is to recognize deviations from the norm and respond appropriately, balancing the need for timely intervention with the risk of unnecessary alarm or disruption to the client. Careful judgment is required to determine if the observed respiratory rate warrants immediate reporting, further observation, or if it falls within an acceptable range for this specific client. The correct approach represents best professional practice because it prioritizes client safety and adherence to the established care plan. By comparing the current respiratory rate to the client's baseline and noting the absence of other concerning symptoms, the aide demonstrates an understanding of individual client needs and the importance of context. This aligns with regulatory frameworks that mandate accurate observation, reporting of significant changes, and following physician's orders or the care plan. Ethically, this approach respects the client's well-being by avoiding unnecessary anxiety or medical interventions, while ensuring potential issues are not overlooked. An incorrect approach that involves immediately reporting the slight increase in respiratory rate without considering the client's baseline or other symptoms fails to demonstrate critical thinking. This could lead to unnecessary medical consultations, increased client anxiety, and inefficient use of healthcare resources, potentially violating the principle of providing care that is appropriate and necessary. Another incorrect approach, such as ignoring the slight increase because it is not a dramatic change, risks overlooking a subtle but early indicator of a worsening condition. This failure to observe and report could have serious consequences for the client's health and would violate the aide's duty of care and reporting obligations. Professionals should employ a decision-making framework that begins with accurate data collection, measuring the respiratory rate. This is followed by contextualization, comparing the data to the client's established baseline and considering any other relevant symptoms or changes in their condition. Next, the professional assesses the significance of the finding based on the care plan and established protocols. Finally, they determine the appropriate action, which may include continued observation, reporting to a supervisor or healthcare provider, or implementing interventions as outlined in the care plan. Question 18. Market research demonstrates that effective collaboration between home health aides and supervising nurses is crucial for optimal patient outcomes. A home health aide is caring for a patient who expresses a strong desire to refuse their prescribed pain medication, stating they feel it makes them too drowsy. The home health aide also observes that the patient appears to be in moderate discomfort, grimacing slightly when moving. What is the most appropriate course of action for the home health aide in this situation? Option A. Respect the patient's refusal and do not administer the medication, assuming the patient knows best and will communicate their discomfort if it worsens significantly. Option B. Administer the pain medication as prescribed, explaining to the patient that it is necessary for their pain management and that the nurse will be informed later. Option C. Inform the supervising nurse immediately about the patient's expressed refusal of medication and the observed signs of discomfort, requesting further guidance on how to proceed. Option D. Advise the patient on alternative pain relief methods that do not require a prescription, such as gentle stretching or deep breathing exercises, without consulting the nurse. Correct answer is C. Inform the supervising nurse immediately about the patient's expressed refusal of medication and the observed signs of discomfort, requesting further guidance on how to proceed. Explanation. This scenario is professionally challenging because it requires a home health aide, HHA, to navigate a situation where a patient's expressed wishes conflict with the clinical judgment of a supervising nurse. The HHA's primary responsibility is to provide care as directed by the care plan and the supervising healthcare professionals, while also advocating for the patient's well-being and respecting their autonomy within the bounds of safety and established protocols. The challenge lies in balancing these potentially competing demands without overstepping professional boundaries or neglecting critical patient needs. Careful judgment is required to determine the appropriate course of action that upholds patient dignity, ensures safety, and maintains effective communication within the healthcare team. The correct approach represents best professional practice because it prioritizes clear, respectful, and direct communication with the supervising nurse. By informing the nurse about the patient's stated preference and the observed symptoms, the HHA is fulfilling their duty to report relevant patient information. This allows the nurse, as the licensed professional responsible for clinical assessment and care plan modification, to make an informed decision. This aligns with regulatory frameworks that emphasize the HHA's role as a member of the care team, responsible for observation, reporting, and executing delegated tasks, rather than independent clinical decision-making. It upholds the ethical principle of beneficence by ensuring the patient receives appropriate medical attention, and the principle of respect for autonomy by acknowledging the patient's wishes and facilitating their communication with the appropriate professional. An incorrect approach that involves the HHA independently deciding to administer medication or alter the care plan is a significant regulatory and ethical failure. This constitutes practicing beyond the scope of an HHA's license and training, which is a direct violation of regulations governing home health services. It bypasses the critical oversight of the licensed nurse, potentially leading to medication errors, adverse drug interactions, or inappropriate treatment, thereby violating the principle of non-maleficence, do no harm. Another incorrect approach, such as ignoring the patient's request or the observed symptoms, is also a failure. This neglects the HHA's responsibility to observe and report changes in the patient's condition, potentially delaying necessary medical intervention and violating the principle of beneficence. Furthermore, failing to communicate with the supervising nurse undermines the collaborative nature of healthcare and can lead to fragmented care. The professional decision-making process for similar situations should involve a clear hierarchy of communication and action. First, the HHA must accurately observe and document the patient's condition and any expressed concerns. Second, they must communicate these observations and concerns promptly and clearly to their direct supervisor, the licensed nurse. Third, they must await further instructions from the nurse regarding any adjustments to the care plan or interventions. If the patient's condition is emergent, the HHA should follow established emergency protocols, which typically involve contacting emergency services and informing the nurse immediately. This systematic approach ensures patient safety, adherence to regulations, and effective team collaboration. Question 19. The efficiency study reveals that in a home health setting, a patient with diabetes has fallen and is complaining of hip pain. The home health aide is present. What is the most appropriate immediate course of action to ensure patient safety and adherence to emergency protocols? Option A. Offer the patient a pain reliever and monitor them closely for the next hour to see if their condition improves. Option B. Leave the patient to gather a first aid kit and a blanket before calling for assistance. Option C. Immediately call emergency medical services, 911, and stay with the patient to provide comfort and monitor their condition until help arrives. Option D. Attempt to help the patient stand up and walk to a chair to assess their mobility and pain level more accurately. The correct answer is C. Immediately call emergency medical services, 911, and stay with the patient to provide comfort and monitor their condition until help arrives. Explanation. Scenario analysis. This scenario is professionally challenging because it requires immediate, decisive action in a potentially life-threatening situation while adhering to established safety protocols. A home health aide must balance the urgency of the emergency with the need to maintain patient dignity and safety, all within the scope of their training and responsibilities. The presence of a fall, potential injury, and the patient's underlying condition, diabetes, create a complex situation demanding careful judgment. Correct approach analysis. The correct approach prioritizes immediate safety and assessment, followed by appropriate emergency response. This aligns with best professional practices for home health aides, which emphasize the importance of remaining calm, assessing the situation, ensuring the patient's immediate safety, and then contacting emergency services or the designated supervisor as per protocol. This systematic approach ensures that the patient receives timely and appropriate care, minimizing further risk. Regulatory frameworks for home health aides typically mandate that aides report changes in patient condition and emergencies promptly and follow established emergency procedures, which often include calling 911 for serious incidents like falls with potential injury. Incorrect approaches analysis. One incorrect approach involves delaying the call to emergency services to first attempt to move the patient. This is a significant regulatory and ethical failure. Moving an injured individual without proper assessment can exacerbate injuries, leading to further harm and potential legal repercussions. Home health aides are trained to assess and stabilize, not to perform complex patient repositioning in emergency situations without appropriate equipment or training, which could violate patient safety standards and potentially neglect the duty of care. Another incorrect approach is to assume the patient is not seriously injured and to simply offer comfort and monitor them without initiating emergency protocols. This represents a failure to adhere to emergency procedures and a potential breach of the duty of care. The aide's role is to recognize signs of distress or potential serious injury and act accordingly. Ignoring potential serious consequences of a fall, especially in a patient with a condition like diabetes that can affect healing and recovery, is a direct violation of safety protocols and ethical responsibilities. A third incorrect approach is to leave the patient unattended to gather supplies before calling for help. This is a critical safety failure. In an emergency, the patient should not be left alone, especially after a fall. The aide's immediate presence is crucial for monitoring the patient's condition and providing reassurance. Leaving the patient unattended violates the principle of continuous care and supervision during an emergency, which is a fundamental aspect of home health aide responsibilities and safety guidelines. Professional reasoning. When faced with an emergency, a home health aide should follow a clear step-by-step process. 1. Ensure immediate safety, e.g., prevent further falls. 2. Assess the patient's condition, consciousness, breathing, obvious injuries. 3. Activate emergency response, call 911 or designated emergency contact/supervisor based on protocol and severity. 4. Provide basic care within their scope of practice while awaiting professional help. 5. Document the incident and actions taken. This structured approach ensures that critical steps are not missed and that the patient receives the most appropriate and timely care according to established safety and regulatory standards. Question 20. The performance metrics show a pattern of confusion regarding the distinct roles and responsibilities of home health aides, HHA, personal care aides, PCA, and nursing assistants, NA, within the agency, leading to potential scope of practice issues. Which of the following best describes the fundamental difference in their scope of practice and regulatory oversight in the context of U.S. home health care? Option A. Home health aides primarily provide personal care and assistance with daily living activities under nursing supervision, while nursing assistants, with specific certification, can perform a broader range of delegated nursing tasks. Personal care aides offer non-medical support, often with a focus on companionship and household tasks, with their scope varying by state. Option B. Personal care aides have the most extensive medical training and are authorized to administer complex medications, whereas home health aides and nursing assistants focus on non-medical support and basic assistance. Option C. All three roles, home health aides, personal care aides, and nursing assistants, are essentially interchangeable and perform the same set of duties, with the primary distinction being the agency's internal job titles. Option D. Nursing assistants are solely responsible for all direct patient care, including medical procedures, while home health aides and personal care aides are limited to administrative tasks and scheduling. The correct answer is A. Home health aides primarily provide personal care and assistance with daily living activities under nursing supervision, while nursing assistants, with specific certification, can perform a broader range of delegated nursing tasks. Personal care aides offer non-medical support, often with a focus on companionship and household tasks, with their scope varying by state. Explanation. Scenario analysis. This scenario presents a common challenge in home health setting where the lines between different caregiver roles can become blurred, leading to potential scope of practice violations. The performance metrics highlight a need for clarity and adherence to established roles, which is crucial for patient safety, regulatory compliance, and effective team collaboration. Misunderstanding these distinctions can result in inadequate care, overstepping professional boundaries, and potential legal or ethical repercussions. Correct approach analysis. The correct approach emphasizes the distinct responsibilities and limitations of each role. A home health aide, HHA, typically provides personal care and assistance with activities of daily living under the supervision of a nurse, focusing on non-medical tasks. A personal care aide, PCA, offers similar non-medical support, often with a broader focus on companionship and household tasks, and may have slightly different regulatory oversight depending on the state. A nursing assistant, NA, also known as a certified nursing assistant, CNA, in many U.S. states, has undergone specific training and certification to perform a wider range of delegated nursing tasks, including vital sign monitoring, basic wound care, and specimen collection, all under the direct supervision of a licensed nurse. Recognizing these differences ensures that care is delivered by the appropriately qualified individual, meeting the patient's specific needs within legal and ethical boundaries. This aligns with federal regulations, e.g., Medicare conditions of participation for home health agencies, and state-specific licensing and practice acts that define the scope of practice for each role. Incorrect approach is analysis. One incorrect approach might involve assuming that all aides perform the same duties, leading an HHA to delegate tasks outside their scope, such as administering medications or performing complex wound care, which are typically reserved for nursing staff or NAs under nurse supervision. This violates regulations that define the scope of practice for HHAs and could lead to patient harm. Another incorrect approach could be to view PCAs as interchangeable with HHAs without considering potential differences in training, certification requirements, or the specific services they are authorized to provide under state law. This could lead to a mismatch in care delivery and potential noncompliance with state-specific regulations governing PCAs. A third incorrect approach might be to assign nursing tasks to an HHA or PCA that are clearly within the scope of an NA, such as taking vital signs or assisting with certain treatments, without ensuring the individual has the necessary certification and training. This not only places the patient at risk, but also violates the established hierarchy of care and the regulatory framework that dictates who can perform specific medical tasks. Professional reasoning. Professionals should approach this by first understanding the specific state and federal regulations governing each role within their practice setting. This involves reviewing job descriptions, agency policies, and the scope of practice outlined by state boards of nursing and health departments. When faced with performance metrics indicating role confusion, a professional should initiate a review of training protocols, clarify role expectations with staff, and ensure that patient care plans accurately reflect the services to be provided by each caregiver type. This proactive approach prevents scope of practice violations and ensures patient safety and regulatory adherence.